Wet age-related macular degeneration. We discussed how the dry form of macular degeneration can cause vision loss slowly, if it ever causes vision loss at all. On the other hand, the wet form can cause vision loss rapid, and treatments are required to potentially reverse any changes in the vision, and especially to prevent any irreversible worsening. Wet, also called exudative or neovascular macular degeneration, is characterized by the growth of abnormal blood vessels underneath the retina. These blood vessels can leak fluid underneath the retina or into the retina, causing vision to decrease. And in severe cases, the blood vessels can break and bleed, sometimes causing massive bleeds underneath the retina that unfortunately can lead to permanent damage and scarring, with resultant severe central vision loss. Thankfully, the past few decades have seen the advent of eye injections that can treat this otherwise blinding disease. The duration, frequency, and end goal of injection treatments may be different between retina specialists and patients. However, many typically follow a similar course. One injection performed per month for the first 3 months, followed by either an increase in the interval between injections if the patient is responding well, or a switch in the medication if the patient has a poor or incomplete response. Because these abnormal blood vessels tend to want to grow back, oftentimes some form of treatment is potentially needed for a lifetime. Retina specialists will use OCT imaging, an imaging test that allows us to view the microscopic amount of fluid developed within or under the retina as a marker for treatment response. Of course, many retina specialists will have different opinions, but typically most specialists will treat until no fluid is observed on the image, indicating that abnormal blood vessels are inactive and have almost zero risk for breaking, bleeding, and causing vision loss. And then timing between the injections can be increased so that there is still no observable fluid inside or underneath the retina in time for the next scheduled injection. Patients, of course, will have different responses to treatment. Some will need an injection every month to keep the disease at bay, while others may go 3 to 4 months between injections. Some doctors may even hold off injections and monitor patients closely to see if the fluid returns. These decisions are personalized and are the result of clear communication between a patient and a doctor who have gotten to know each other well over the course of treating this disease.